afternoon. I think we'll go ahead and get started with the award presentation. And thank you all for being here today. We really appreciate you being out here to recognize the CHOC program. What a great program. My name is Cindy Samuelson. I work with the Kansas Hospital Association. We're going to hear a little bit about the award from Tom Bell. He's the president and CEO of the Kansas Hospital Association. And then Ron's going to share a little bit about the program. A lot of you are very engaged with the program, and I know you know a lot about it, but we want to highlight what the program does for the community because it is a fabulous program, and we're thrilled to be here to award it. So without any further hesitation, I'll turn it over to Tom to tell us a little bit about the award. Tom?
Cindy, thank you very much, and thank you all for being here this afternoon. This is an important, very important program for us, and it's really an honor and a thrill for us to be able to come out to your facility and reward all the hard work that's been done with this small token of our appreciation. But you know, we started this program, excuse me, several years ago, and what we wanted to do with it was to help our member hospitals and the people that are in their communities understand that hospitals are more than just buildings. They're more than just bricks and mortar. They're more than just a place that you go to get care when you get really, really sick. They actually are part of the community. Reach out to the community. They're there 24 hours a day, 365 days a year, but they serve the people in that community. And this program is designed to showcase the sorts of programs that, like this one, that really demonstrate that. And as we looked at the entries this year, and there were over 70 of them across the state, so this is a pretty selective deal. It's pretty clear that what you're doing here, the CHOC program, the Community Health Organization Committee, is a great example of what we wanted to do. It provides leadership. It reaches out into the community. It provides a service that people wouldn't have otherwise gotten had you not come together to do this. And it really shows the essence of what a community hospital is, reaching out to the people that it serves, reaching out to friends and neighbors, and providing care, services, and a quality of life that you might not otherwise have had if you all didn't get together to do this. So it's my pleasure to be here to award this presentation to you and to thank you for doing what you do. As I said, we're thrilled to be here and just as happy as we could be that you all are the recipient of our Community Connections Award this year. So let me turn it over to Ron for a few minutes, talk a little bit about the program, and I don't want to take too long because I see there's lots of good food at the back. Ron, just one quick thing. I apologize. I wanted to say thanks to Mike Zamersley, who's from Representative Jerry Moran's office, for being here. Mike, we appreciate you being here, and please let Representative Moran know how much we appreciate all he does for rural health care in Kansas.
Thank you, Tom. I think almost everyone here knows that I'm Ron Baker. I'm the interim administrator. Kurt left us a couple of months ago, and we'll be here at the very least to get you through to your next person. As a result of being interim and being new, I probably know less about CHOC than almost all of you in here. But it has been very interesting to me to learn a little bit about it. And I think if I'm going to bring anything at all to this, is sometimes when you're in the midst of doing your work every day, you kind of lose track of maybe how far you've come, or maybe even lost track of where you are evolving or going to. So I kind of want to go back in time and talk a little bit about how you came together and what happened. Many years ago, you know better than I, your really sometimes competing entities got together and decided, you know, if we joined hands, we could probably accomplish more together than if we fought with each other, competed with each other, whatever you want to call it. You know, Jayhawks and Wildcats, we live this all the time. But the Satanta Hospital District, the Sublette Hospital District, and the Haskell County Commissioners got together and decided, you know, let's get something going here, and they got your CHOC organization formed. So then you started working on projects. Obviously, your objective was to improve the health and wellness got health fairs going.
Call 282. Ron Pickler, call 282, please.
That's very confusing. Pickler and Baker, that sounds too much alike. You have your health fairs, preventative screenings of many types, but more than anything, wellness issues revolving around your smoking cessation, nutrition, fitness, drug and alcohol abuse. And obviously the program which received this award was concentrating on some of the younger kids, teenage and younger, and really started working with a lot of entities in this area to work on alcohol abuse, drug, tobacco, and then abstinence programs. You were able to bring a lot of folks together. And I think about, cold calling these people, let's get going on this, let's work on this, and let's get these programs out. Got great coordination between public health and the hospital now. You've got your school districts involved, you've got your churches involved, law enforcement, civic groups. Really, you brought the whole community together to work on these projects. Now, like anything in healthcare, anything in life, change occurs. And you've had changes take place. Grants come and go. You have to live within the grants. You've got to go out and seek new grants. You've got to make sure you've got your funding in place. As those change, your programming is going to change. So as you move down the road, you've got other issues and elements that you want to work on. This is, I think, in many respects, very revitalizing for an organization like CHOC to get some of this recognition and to kind of start things up again, get you looking in new directions for where you're going. I was fortunate enough to attend your last meeting, and I'm hearing some nice things, especially in terms of fitness and weight control and smoking. One of the great challenges we've heard a whole lot about over the last year or so is healthcare insurance, the need for the insurance, the rising cost of insurance, and what can you really do to lower those costs. And one of the things on a local basis is the fitness, it's the weight control, is the smoking. You get that done, you have the healthier population, and you help rein in the cost. The problem is that's not something you'll immediately see. You make your people healthier, and you're not going to see, oh, my insurance costs dropped $20 this month because I'm healthier, or they're lowering my premium because I quit smoking. But down the road, you will see less of an increase in those costs as you accomplish that. So I guess that's where we're at today. Where are we going to go tomorrow? How can we take this and invest it into the future, into these programs, and make it move? And that's what we're looking forward to.